My name's James. On behalf of the fellow organizers of this workshop, the goal, the sort of meta goal that I think you're absorbing as you listen to this is how do we enable social good? How do we enable research in health and in genomics by utilizing data or methods or information or learnings that we wouldn't be able to otherwise if we didn't have a way to deal with privacy as part of the learning process. So we've talked about what are the structural problems, what are the things we might be interested in learning, what are the connections of this to the real world, to the way the data is stored, to the way that to the systems that hold the data, to the financial incentives of who owns the data, as well as discussions about what are the fair uses of the data. How do we make sure data isn't used against people, not just that their data isn't leaked? Hopefully that all brings that together, and we can start to think about, okay, so if we're trying to kickstart methods and systems that might actually bring about these learnings, how do we build them? For this session, we've brought together people who can speak directly to those questions. People who've worked on systems to compute learning on private data in the health context. We have Paul Comerford from the Information Commission Office of the United Kingdom, who's got a fascinating, as I was just occurred to me on the top of my head, the sort of the Platonic ideal of the system we might be talking about, and he'll describe his system better than I can. Joe Neer, who needs no introduction, has been a long partner with OpenDP on a number of systems, and I've had the pleasure of interacting with him building systems for DARPA in this space. Lucilla Ohno-Machado, who we've already heard from, and has already given the most sort of detailed overview of the way systems exist right now in the field, in practice, and Peter Kairouz from Google, who will describe. I do actually now that I get to the end of realize that it's ridiculous of me to introduce most of these people unless some of you have arrived from 20 years in the past and have just arrived in this particular decade. So the first way I want to begin this is just to ask everybody to introduce themselves for 5 minutes. And describe something that I think is most relevant as an example of the kinds of tools that either they would like to build, have tried to build, have experience building, or have struggled with, and sort of highlight what is it that ideally we should be building in this space.
Thank you, James. So I'll start off. So I'm Paul Comerford. I work as a principal technology advisor at the UK ICO. They are basically the data protection regulator for the UK. So we oversee regulation of the GDPR in the UK as well as other laws. So my role involves a number of different things. I was involved in developing the guidance on anonymization that we published a couple of years ago, and also the guidance on pets that was published a couple of years before that. I want to talk today about a project I was involved in with a number of partners within the UK and the US. This followed on from a Pets Prize challenge that was done probably about 4 or 5 years ago now, with 2 tracks. One was a healthcare track that looked at COVID data, and there was a financial track as well. That was quite a successful project, and that spawned a project about 2 years ago that looked at sharing data on rare pediatric cancers to identify patterns from 2 different data sets, one from US data, health authorities, and one from the UK National Health Service. The problem there was, as has been described in some of the earlier talks, was that we couldn't actually move data across borders. each party was reluctant to share the entire data with each other. There was restrictions around sharing that data, but there was obviously opportunity to combine that data in some way using pets to discover patterns in that data that you wouldn't otherwise be able to do. So back in 24, 25, DSIT, which is a sort of a branch of the UK government, coordinated a project involving the NHS and the National Cancer Institute in the US and the NHS in the UK to develop a PETS-based solution. And this leveraged several PETS federated analytics to perform queries on the data locally, so the data doesn't actually move, it stays within the organizations. Also uses enclaves as well, trusted execution environments to keep that data secure, so each party can't see the data. And lastly, aggregate statistics were derived from the data using differential privacy to ensure that no one could be singled out or identified from that data, and also some small count can't get my words out, suppression to ensure that any outliers were dealt with. So this was a multi group project. Our role from the ICO was mainly looking at the GDPR compliance. We weren't really involved in the low-level design. However, we reviewed risk assessments. Obviously, the parties involved wanted some confidence that the parameters that they were using were appropriate and the data was sufficiently anonymized. So we worked closely with the various partners involved. NIST were also involved from the US side to ensure that due diligence was done and the risks were sufficiently mitigated. And I have to say, it was a really successful pilot. Got some really useful results out of it. We published a couple of blog articles from the UK side, which provides a lot more information than I can in a few minutes. But yeah, it just shows that using appropriate PETs and DP, these things can be done and barriers can be overcome. So, I think it serves as a really useful blueprint for what can be done in the future.
So my name is Joe Neer. I'm an associate professor at the University of Vermont in the computer science department. And I've done some work on systems for differential privacy. I've done a little less work specifically on health research. So I have a couple of points of experience that I want to mention. But in general, I think there's lots of lessons we've learned in trying to deploy systems in other areas that might carry across, and some that maybe don't so much. So I have worked on a couple of projects that specifically touch health research. So one is a couple years back, I helped out in an effort to reproduce results from a cancer study with a health system in Illinois. And I had a very small role in this. I had a very small role in both of these, actually, but I learned some stuff from them. They were using a system to process queries that I had helped build, and so I helped them out in doing this. The other piece of this that I helped out with is that they, in order to show that they were HIPAA compliant, they wanted to follow the expert determination portion of HIPAA. And so I was the expert to do the determination, right? And so half of my experience in this was like, how do I explain what differential privacy means to, usually it was like to a bunch of doctors who were then going to go talk to a bunch of lawyers. And they need to be able to explain to the lawyers why the expert says that this is okay and it really is okay. And so they were like, okay, what does epsilon actually mean? And I'm like, well, can you just tell me what's the probability of a bad thing happening? And I'm like, well, no, you've got to know what the adversary knows in order to do something like that. And they're like, fine, give me an example. And I'm like, okay, here's 3 examples. And And so it was, you know, I think we've heard exactly this kind of story in lots of other areas where it's like, you know, to really give somebody the background to understand this would take a year, maybe. And like they want to see a few examples, and you know, maybe we need some patterns for explaining things to lawyers or to people who don't have that background so that we don't have to invent it again over and over again. The other thing that came out of that experience for me that was really, I see a lot of overlap with other areas and that really seemed to be a big barrier is, you know, basically they were writing SQL queries against a database and they were using a system that I had helped work on to add to do it with differential privacy and get differentially private answers. And they were like, okay, that's great, but I also need confidence intervals now, right? And it's like, yes, of course they need that, right? But the tool we designed wasn't really designed with that in mind. And so they were like, this is not very useful unless we can also get the confidence intervals. And it's the kind of thing where, you know, we go off and we build a tool and we think this can do the things people want it to do. And then they come back and say, we need this other thing. And we say, oh, that's an easy thing, or it's a small thing, or like, we did the hard part, right? Like, that's just a small engineering addition. And it doesn't matter if it's a small engineering addition, like, they can't do their job without it, right? And I think this kind of thing has popped up in lots of different places where I've seen barriers to deployments where, you know, we consider something to be a small engineering thing, but to the person trying to do the work, it's a blocker, right? And the other thing that kind of comes up a lot, although I think because they were used to SQL, this didn't come up in that case, is even just asking somebody to use a tool they haven't used before is a blocker, is a barrier, right? And you know, since then, not in health, but in other areas, I've done a lot of research in how do you build tools people can actually use? And the answer is, if you give them a brand new tool that you designed for yourself, they're not going to be able to use it, right? Like, it's not going to happen. So I think a lot of those lessons can kind of translate to this medical area too. The other project that I want to highlight is actually one that Mosen, who's in the audience here, is going to talk about in the next session, where there's a study at the University of Vermont looking at mental health of undergraduate students and collecting data from surveys and also from wearable devices like these rings that can record your heart rate and stuff. And so what Mosen was able to do is to use AIM to release a differentially private synthetic data set corresponding to that study. And so, you know, I think there's, this I think is a pretty good success story in the sense that like that data just wasn't available before and now it's possible to release it. So those are the two I'd highlight, but I think there's lots of challenges, right, remaining that kind of maybe seem like just small engineering challenges to us, but are kind of roadblocks for people who actually need to get things done.
Yeah, so I'm Lucilla Ohno-Machado. One of my jobs is to create the infrastructure for sharing that people can trust and that keeps the patients trust in the system as well as the other stakeholders. And I think someone here mentioned they had a DP hammer and they were finding nails that fit. And I think that's so very true. That sometimes because we love the theory, we love the elegance of the approach, we forget about details that are super important in that, you know, if you can obtain the non-altered data, why wouldn't you do that? And many times it's because, but I need to create a protocol, do an IRB approval. Yes, you can, you still can. So just because it seems like an easier thing to do, the research won't be the same quality, right? We know that. There is something lost when you do have to alter the data. Sometimes it's necessary, and thankfully there are solutions for that. But sometimes it's a matter of, you know, it is the same phenomenon. For a computer scientist, it is another world that's out of the comfort zone to write an IRB protocol, get it, you know, a review back. Oh, you need to fix this, this, and this. And the best thing is to collaborate with someone who does those things and to get the data the way they are. It would be my first choice. Second choice, you know, other protections and so on. But by no means one thing, just excludes the other. I think it's these things together that make the applications very important. And in some other projects, I dealt with, for a long period of time, I believed that the patients should choose, I still believe that, but that they should choose which data elements they wanted to share with which institutions for specific purposes. So I may want to contribute to cancer research, but I'm not as inclined to participate on a dermatitis study, for example. So people have different kind of motivations. These days, the most common is an all or nothing. If you go to a hospital, you get treated there and so on. All you can do in most cases is say, I want to be excluded of all research that happens here. When in fact, you had just one particular disease that you didn't want to disclose or something, and then you're kind of destroying your whole record just because of one thing. So we did research in those areas, and it was quite informative. The one main take home is people like to be asked. Many didn't change a single thing. They said, oh, you have it the way the institution wants to do it, and that's fine. But presentations during several years, there was always someone who said, well, if you give that option, the same groups that are currently excluded from research will exclude themselves from research, and then you're biasing data that was less biased, was still biased in other aspects. And because our studies were small, we couldn't determine if that would have happened or not. And the institutions where we did the research were afraid that that would happen, so they limited to, oh, this is an experimental study where people can choose for 2 years and then we get back to normal. So it remains to be seen. I think it's an area that we need to think about, inspired by the previous talk here. A model influences people in different ways, and it may have very unintended consequences. So it's not, it's not as simple to deal with healthcare data as it would with some geological data, for example.
So I'm at Google. I'm a research scientist. I'm part of a team whose mission is to safely and privately unlock access to user data in order to improve both evaluations and the models that power a lot of the AI experiences. Now, 10 years ago, when foundation models was still not a thing, the way this looked is we would train a very task-specific model for a certain use case. And we would, because the model was actually quite small in the tens up to hundreds of millions of parameters, we could actually train that model on device. So we don't have to collect and move the data to the data center. We could actually instead use federated learning techniques combined with differential privacy, secure aggregation, so on and so forth. Train a state-of-the-art ML classifier or some model for a certain task. Now, 5 years ago until today, a lot has changed. Two main things. The models kept getting bigger and bigger and bigger. And so today we talk about many billions of parameters, hundreds of billions of parameters. But also the other paradigm shift was instead of designing one specific model for one task using one data modality, we started combining data from all sorts of modalities and tasks, and we went generative. And so these two introduced lots of challenges to the core mission of what we do at Google, especially what our team does. And so we had to evolve. And we evolved in two primary ways. The first one to address the scale challenge around the size of the model. we moved towards performing federated computations with DP in trusted execution environments. We use confidential compute. And that gave us the advantage of being able to verify what computations we're running and what kinds of guarantees we can give to our users. So that actually had a benefit in addition to being able to scale to larger models. And then because these days the teams are not designing a specific classifier, but rather they have these generative style features that they want to power, we moved towards a service where we would either give insights or we would try to synthesize data that we believe teams would find very valuable in terms of how they evaluate models, like Gemini models, or maybe even how we would improve the next version of these models. So the shift towards synthetic data versus training classifier was also a big one. And I think tomorrow, Dan Remage from our team is going to be giving a 9:15 a.m. talk on the recent advances in this space. Now, this is all to say that in this process of almost 10 years at Google, I had lots of conversations with people who were using the same set of techniques, especially on the federated side, applying them to health and genomics data. And one of the primary technologies that they were using was a combo of what's called cross-silo FL, which is our cross-institutional FL, as opposed to the one that we use very frequently at Google, which is cross-user or cross-device FL. And then with DP to give some guarantees or to train these models safely. But in those conversations, what I discovered is that, first of all, there's no specific definition of a user. So the unit of privacy is off in many ways. They did not even have in their data sets the notion of a user ID, even like a pseudo ID of some sorts. So it was basically a flat data set, and they were using this FL plus crypto technology to essentially join data sets that are vertically partitioned and then just train a classifier. And they would sometimes train it with record level DP and call it a day and think that that's the right thing to do. So there's basically a lot that's not right in that way of doing things. They're not protecting patient-level privacy per se. They're using this technology to bypass certain regulations as opposed to like doing it because they truly care about the patient privacy. But also what I discovered is that oftentimes what they truly care about is IP and not privacy. So they are afraid of potentially a competitor learning from their data. And some of them even thought that DP is actually a way to protect your own IP, which is obviously not true because, again, the way they're applying DP is at the record level, not even at the IP level, which I don't know how to apply. So this is all to say there's a lot of work that needs to be done in this space, and hopefully in this panel we're going to discuss some of them.
That was good salesmanship that there is early tomorrow morning. Interesting talks, including at 9:15. We'll all be here, but not here in Alston. Don't turn up in the ballroom. I don't know. It might be a dance session that is here. Towards that end, you sort of sold this idea. A bunch of people have talked about the promise of things that we can do if we have better pets. I think almost everybody here has highlighted that DP in these kinds of systems are not working on their own. It's like Jonathan Ullman was talking about in the earlier roundtable. DP and TPDP is sometimes a euphemism for a central idea about what privacy is and the combination of pets you might use to unlock data. So as we unlock data, I found from trying to build systems that have nothing to do with healthcare, it's a very hard sell to be the data scold who says, you do this thing already, but you shouldn't be doing it. You're violating privacy. You should do the thing you used to do, but just noisier now. That's a very hard sell. But the easier sell is, there's this thing you never could have imagined you would have been able to do, and if only you can learn how to do it with privacy, you can do it. You can unlock this data, you can join these data, you can explore this question that you wouldn't otherwise even ask because it's privacy preserving. I would love to know Do you have anybody here have thoughts about what are the ways that we can sell? What are the questions that you think we should be pitching to people in this room to be unlocking? What are the questions that are possible with privacy that we maybe otherwise wouldn't get good answers or we can get better answers with? And maybe also along those lines, in addition to the next DP algorithm, what's the combination of other pets that you sort of think are going to be necessary in those kinds of systems to unlock those answers?
I mean, I can go first, but I guess just following on from what I described before, the system I described before, I think some of the talks earlier discussed potential use cases of where data could be combined, that's a bad word, analyzed with pets. I guess it depends on the restrictions around the data as well and what the parties are willing to share. In the case I was talking about earlier, there was a few specific requirements. So personal data could not be shared across boundaries. That was one of the requirements. So we needed a system that would satisfy that requirement, and that's where DP came in, and that was really effective at providing that level of anonymity. Basically, no personal data was transferred across borders. That made things a lot simpler, and the requirement for approvals, which I understand would typically take up to a year for this type of data, was drastically reduced to about 2 months. So a significant reduction in the amount of bureaucracy. It's probably not the right word, but the approvals process was significantly simplified. Every situation is different, so there might be other legal gateways that might allow sharing, but I'm just talking about this particular case where no personal data could be shared across borders. It was also a layered approach as well. It wasn't just applying DP. It relied on a few different technologies layered together to provide data minimization, so the data was kept locally. There's also synthetic data used as well. So a lot of the testing was done with synthetic data first to prove that the system worked effectively before the real data was used, and that worked really well. I think it was also important that there was a lot of technical expertise involved from the likes of NIST. So, they had to, certain parameters had to be chosen, epsilon, and the people from NIST were really helpful in applying the appropriate parameters to the solution in hand. I guess the challenge from our perspective was the mapping all those techniques and technologies to compliance. So in some cases that was quite easy with some of the cryptographic pets, but with DP, there's always that question arises, is it enough to get you over that threshold of anonymity? And we looked at our anonymization guidance, which doesn't really say a lot about DP, and tried to map what that says about identifiability to the techniques used, and also the teams did some actual practical testing on the data to provide a level of assurance. But as some of the talks highlighted earlier, it's always a challenge to get across something that's very mathematical to doctors and clinicians that don't really have that level of expertise.
And if you haven't seen the ICO's anonymization guidance, and you're like me, and a mathematician who's always like, why can't the legal people just translate this stuff into, you know, and tell the world that you can do privacy? It's a really good building block towards that consensus that we're all looking for. I would encourage people to read it.
So I've got a couple areas that I think there's a lot of overlap with this, actually. The first one, I think, so opportunities for like, where can we avoid being the privacy scold and instead provide opportunities, right? And I think I feel like this is a theme that comes up every single TPDP because we all don't want to be the privacy scold. To some extent, like being a privacy scold, I think works a little bit, right? Like somebody has to be the privacy scold, and so maybe we should be to some extent. But if we don't want to be, right? I think within one organization, right, if you've got some data, you can just use it, right? I think there are some organizations that can get credit for releasing data to the public. Like, they look good when they do that, right? And so, you know, I think differentially private synthetic data maybe could provide organizations a path towards doing that. And, you know, maybe we can position ourselves as, you know, you'll be doing this public good by releasing data, you know, survey data or, you know, health study data, and people will like it if you do this, and so you should use our differentially private synthetic data approach to do this. I think that with synthetic data especially, how do you know if it's good or not? You know, we've seen lots of talks that are talking about how do you measure utility in synthetic data, and to some extent, I think the most general answer is maybe you can't, or like, you know, there's not going to be ever like an excellent way to do that, and you kind of just have to try it and then let people use it and see if it works or not. But I think it's worth a shot. Just like try to encourage synthetic data and, you know, look for places where people can get credit for releasing it. I think the second kind of opportunity where, you know, people would like to be able to use more data and they can't currently do it is when the data needs to be shared across organizations. And I think that, you know, people have talked a lot about this, and, you know, Paul, you just talked about this too, right? I think this is a little bit, for us as the differential privacy community, I think we need to look at stuff that's not differential privacy in addition to differential privacy in order to enable that kind of thing, right? So, and I'm particularly excited about this because I think that kind of stuff is really cool, but, you know, can you combine cryptographic algorithms or protocols that can let you join data and then release differentially private results? You know, I think a lot of the solutions that will allow you to share stuff across organizations, maybe you need to look beyond just differential privacy by itself. We need to combine it with other things, or it's just really hard to get there. So I think there's lots of opportunities like those where maybe we can avoid being the privacy scold. But also, I think we shouldn't shy away from being the privacy scold. Somebody's got to do it.
So speaking about that, I think it's also recognizing the users, which someone says here, because you need to apply differently the degrees of privacy protection. If it is a user that you can detect and do something about it, that's completely different than if it's a user you have overseas, you have no control, and you don't know what they're doing. So I think to release to other institutions, it's probably the way to go. Whereas sometimes institutions get so worried that they don't even share among themselves or peers, that they're not competing, they're just collaborating. So I think understanding these degrees of trust in pairing with the appropriate, even within the DP, how much privacy budget you give or not, right, would be the right way to go. But yeah, be very open-minded about the DP not always being the best solution.
Yeah, so maybe I'm going to rehash some of what was said, but I think it's important when we talk about unlocking to first decide who are we going to unlock this data for. So I think there are three categories of entities that we might be interested in. The first one is just internal use of the data. So like say, let's take Mayo as an example, Mayo Clinic. They might have a lot of their own in-house researchers, data analysts, scientists, so on and so forth. And it's one thing to use Mayo Clinic data internally versus potentially sharing that data to an outside entity. the privacy bar, the risk vectors, different profile altogether. The amount of user consent, just drastically different. And so I would like to first see the data being used internally, or what can we do on the technology front to make that, to unlock that data internally. And then, for researchers outside, because obviously Mayo Clinic does not have all the researchers in the world, not even a small fraction. So if we restrict access to researchers, there was a talk earlier today about now DP gap is locked down and you need to request formal access, and it's a lengthy process. You have to submit. I tried myself to do it, by the way. It's actually very tedious and lengthy. But should we make any person outside go through the exact same process as a vetted researcher who's willing to sign a form of some sorts? And how complicated should that process be? Maybe if we are using some of these technologies to synthesize, possibly with DP, with a weak epsilon, potentially with also some auditing on top of it, maybe then we should simplify that process and make it much easier for these experts to access those data sets. And then the third entity is when we would put that data out, say via training the next iteration of MedGemma, which is an open source model. Here now the surface of attack is actually much, much larger, because you have billions of people who can access MedGemma, who can poke it and try to reconstruct something about a patient. So I think rather than jumping the gun and going all the way to the third tier of access, of unlocking the data, maybe we should start with the first one and perfect it and work our way up when we understand the risks and the limitations of the technology.
James, who's going to go around and we'll open up for questions in our remaining time. Thoughts in the audience that you want to probe?
Hi. Hi. At least 3 people, I think, mentioned, trying to convince some lawyers or some stakeholders in a concrete, particular deployment that, differential privacy and/or other pets satisfied whatever requirements were in play. And I think it was Joe who said, we need to figure out a way to not have to reinvent this analysis every time. What I've seen in public is general guidance, like the ICO's anonymization guidance, stuff like that. But what is harder to find is the sort of specific deployment, specific to a deployment, opinions, guidance, reasoning that does do the convincing for with the particular details of a particular deployment. I think it would be incredibly interesting to read as somebody outside of the organizations that are doing this, to see what sort of arguments are taking the day and what are the sorts of things that the lawyers are particularly interested in and the way they want those, way that you're finding that you need to frame the arguments. So I guess this is a question. Can we find, are there any things that you can point us to? And it's also a call to please give us some of those. Thank you.
This isn't a healthcare use case, but it is a DP one. Have you heard of the ICO sandbox? It's like an environment where an organization of any size can come in and their solution is evaluated with data protection compliance, basically. So last year, Mozilla solution, which was on privacy-preserving advertising attribution, was evaluated. And a key part of this was using DP to ensure that no individual could be identified from their attribution data. So we did pore over the solution in a lot of detail. There were some limitations. We were basically provided lots of documentation. We reviewed the API documentation. We didn't actually do any empirical testing or anything like that. But we did provide like an in-depth analysis of the solution, caveated they wouldn't provide us with an epsilon. So, you know, yeah, it's online. Yeah.
This is an interesting point about these. So I think one of the challenges with this is that for every deployment, the lawyers might want something slightly different, right? Which doesn't mean your question is not, doesn't imply a useful thing we could do to solve the problem, maybe, right? Even if lawyers want something different every time, if we like took all of the things we write for all the different lawyers and we all post them online so we can each see them, then maybe eventually we can like train a language model to convince the lawyers. I feel like with enough inputs, if we do this enough times, we could find the patterns. I don't know if part of it is maybe that this is kind of sparse in the sense that like I've only done this a couple times, and so it didn't occur to me like, can I post this thing I wrote? Can I just post this online and show it to everybody? I don't know if I'm allowed to do that actually, and I would be happy to do that. And if it'd be helpful to people, then that's great. So maybe all of us together, if we like start posting those things online, that would help. I'm going to go look and see if I'm allowed to do that and actually do it if I am. But yeah, it's a great point. I'm not sure. I don't have any concrete ideas beyond that.
And if you are posting those things, there is a source line in the schema for the registry, which might be one place that you would put links to that documentation.
Yeah, I'm unaware of case reports published about any of those wide-scale applications.
Yeah, I mean, I'm not the expert in the field, but I would say we need more privacy competitions where we take a data set and we try to see, if we can safely synthesize using DP and other technologies, and have literally like a red team and the blue team or whatever, and see from the synthesized data, what can we reconstruct? What types of attributes, what types of properties, and not using the worst case scenarios that people use when they audit a DP algorithm where you like generate random sequences of tokens and you try to reconstruct them, but literally real harms, real risks. There have been some competitions in the past, but they've been limited in scope and size. If we can do a lot more of those, I think it would help lawyers and policymakers better understand, appreciate the risks, or the things that we can mitigate with something like DP and technologies, pets.
So I have a comment and also a question. So I guess I'm a biologist, so I've been to a lot of like policy conferences, biology conferences. Actually, this is the first time I'm coming to a computer science conference. So it's very interesting to learn more from all of you. And like I just feel that there's like a lot of silos where, for example, if I go to the GA4GH meeting for like data sharing in genomics or the Bermuda Principles meeting or some biology conferences, the lawyers don't really understand biologists or some of the technologies. And I just feel like it would be great for people to just like learn from each other a lot more. And so one of the things that I realized is actually really difficult to explain some of these like difficult technical concepts to like policymakers or lawyers. They just kind of get very scared and they just kind of throw the word federated everywhere, and it just means, it's not clear what it means. But then I think there's also like this question of the sin of omission versus the sin of commission, where like the cost of not sharing something might also be sometimes greater than the cost of like, like sharing, right? And so how do you think that, as much as we talk about, there are these barriers, how do you think that we can do more real world deployments like, like at Google or so on?
Okay, so I think more pilots would be a good starting point. I think the pilot I mentioned was very promising, but more needs to be done basically. So I think further conversations around what the opportunities are, what data would be beneficial to share, if you like, and take it from there.
So a very specific thing that you said kind of stood out to me, and that's this like omission thing, the like cost of omission, right? And in the medical field, like that's a very real cost. It might be that like people are going to die if you don't share the data, right? And I wonder if I'm not sure. I don't think I have a solution to that, right? I think you're right that people need to talk to each other more, and hopefully we're doing that more now. But it's hard because none of our fields really incentivize that to the extent that would be ideal, right? So I don't know. I don't know how to solve that problem. I wonder if, in addition to being privacy scolds, we could be cost of omission scolds. I'm not sure. But I also, you know, it related to that. When I saw your talk and you're talking about the, you know, just training language models on huge volumes of health records, right? And like you get language models that really can do more things then. Maybe I don't want people to use differential privacy for that, because if you train without differential privacy, the model might diagnose me better and I might live, right? And so I think there's a cost to not sharing the data. There might even be a cost to using differential privacy when we do it. And it's very rare for me to say maybe differential privacy is not the answer here because I love differential privacy. But in some cases, maybe we are better off just not worrying quite as much about privacy as I personally would like to, because you know the cost of it is balanced by something greater in the medical field.
Yeah, I think we're not good at quantifying what we're missing by not sharing because we don't know. We do know successful sharing with particularly the Genome Project and so on, but that again is measured by publications and not by real life outcomes sometimes, not all the times, but so I think we have not made a completely convincing argument that the benefits outweigh the risks.
I mean, one thing that I want to emphasize is that the base foundation models have gotten like really, really strong over the past couple of years. And it's not very clear to me that we need to be pre-training or post-training those base models with medical data. We can do a lot with just in-context learning, retrieval, context engineering, prompt tuning, and all that stuff. So, and that to me seems to be a very different risk profile versus training the models with medical data and then putting the models out either via API access or the weights of the model. And so maybe one thing to do or to start with is to try to see how much more can we do if we were to access the data at inference through like in-context learning. That's the lowest hanging fruit, and the risk there is very limited. So that's the first thing. And then the second thing, I mean, I agree with what Joe said. Sometimes we just need to maybe fine-tune or train or use a technology and audit it before we decide to what extent we need DP and what value of epsilon we need to set and what privacy unit, you know, how we need to tighten the knobs. I think there's a lot of interesting work on auditing that's happening in our community. And I think that even when we talk about auditing, moving towards auditing the risks that you care about versus doing like a worst case audit of computing an empirical epsilon, using a worst case scenario, like identifying what the harms and risks may be and literally checking against those things that you care about. So this is all in the spirit of not letting perfect be the enemy of the good and rolling this out with some amount of due diligence that, you know, if something goes wrong, we can quickly adjust and adapt.
Hi, thanks so much for the conversation. I really appreciated it. So just a little bit of background. My name is Darcy Kerr. I'm the head of data and AI policy and governance at AstraZeneca, focusing on translational data for research. So quite an interesting talk here. What I wanted to add to the conversation is don't fear the lawyers, okay? It's all about finding a proper risk balance between what you're doing. I love what Paul's done around the spectrum of anonymization in the ICO work. It's a spectrum. It's not good or bad. Same thing with governance. It's about a maturity spectrum. I think what we need to do as a community is start to think about what is on the spectrum. It's not about the specific use cases and what is perfect in each use case. It's more about what is good in certain circumstances, and that way you build a framework from which you can start to educate and get more people involved in taking advantage of all these technologies. And I really appreciated the points made. It's not just about differential privacy, it's about putting the whole package together around what are all the components that allow for private data. But thank you, just wanted to add that.
Well, let me thank the panelists and thank the audience for all the engagement. And let the conversation continue over the next couple of days as these ideas percolate.